Fatty liver, your complete guide to protecting your health before it's too late. Did you know that fatty liver can be a silent time bomb in your body? Discover everything you need to know to protect this vital organ and prevent serious complications. Fatty liver, also known as hepatic steatosis, is a condition in which fat, primarily triglycerides, accumulates within liver cells. This accumulation is not limited to the surface. Fat invades liver cells throughout and within the organ. Fatty liver is defined as a condition where more than 5% of the liver's weight is composed of fat. There are two main types of fatty liver disease: non-alcoholic fatty liver disease, NFLD, which occurs in people who don't consume alcohol excessively, and alcoholic fatty liver disease, which is associated with excessive alcohol consumption. In this article, we'll focus on NFLD, as it is the most common and prevalent type in the general population. It's crucial to understand that, although it may initially be asymptomatic, fatty liver disease can progress to more serious stages if not addressed promptly. Non-alcoholic fatty liver disease develops when the body abnormally accumulates fat and the liver begins to act as a storage facility. This organ becomes clogged with fat between cells, which can be caused by several interrelated factors. Insulin resistance is a key factor in this process, as it prevents the body from utilizing glucose properly, promoting fat storage in the liver. Insulin resistance is a condition in which the body's cells stop responding adequately to insulin, a key hormone produced by the pancreas to regulate blood sugar levels. Insulin acts like a key that unlocks the cell's gates, allowing glucose to enter and be converted into energy. When insulin resistance is present, this key malfunctions, causing blood sugar levels to rise. To compensate for this resistance, the body needs to produce more insulin to achieve the same effect. Over time, this overproduction can lead to pancreatic exhaustion and decreased insulin production. This imbalance contributes to the accumulation of sugar in the blood, predisposing to diseases such as diabetes mellitus and prediabetes. Furthermore, insulin resistance is closely linked to overweight and obesity, especially abdominal obesity. Other factors that contribute to fatty liver include a diet high in simple sugars, such as fructose found in sugary drinks and processed juices, refined flours, and trans fats. A sedentary lifestyle, dyslipidemia, high triglycerides, low HDL cholesterol, and high LDL cholesterol, type 2 diabetes, and alterations in the gut microbiota and gut permeability also play a significant role in the development of this condition. It is essential to understand the dangers of fatty liver disease before it is too late. Although it may not present obvious symptoms or signs at first, this condition is not benign and can progress to more serious stages if preventive and therapeutic measures are not taken. Below is a description of the disease progression, from the initial stages to the most severe complications. Simple fatty liver disease, or steatosis, without inflammation. In this early stage, fat accumulates in the liver, but there is no significant inflammation or cellular damage yet. This stage is reversible and represents an early warning sign, indicating the need to adopt lifestyle changes to prevent disease progression. Non-alcoholic steatohepatitis. At this stage, in addition to fat accumulation, inflammation and cell damage occur in the liver. This is where scarring begins within the liver, which can lead to liver fibrosis. Liver fibrosis. Liver fibrosis is characterized by the formation of scar tissue within the liver. Although this process can be halted in some cases, it is not easy to completely reverse. Fibrosis hinders normal liver function and can affect its ability to detoxify the body and produce essential substances. Liver cirrhosis. Liver cirrhosis is an advanced and irreversible form of liver damage. At this stage, the liver loses its ability to function properly as a detoxification and protein-producing organ. Cirrhosis can lead to serious complications such as ascites, fluid accumulation in the abdomen, hepatic encephalopathy, impaired brain function due to toxin buildup, and esophageal varices, enlarged veins in the esophagus that can bleed. Hepatocellular carcinoma, liver cancer. In some cases, non-alcoholic fatty liver disease can progress to hepatocellular carcinoma, a type of liver cancer. This cancer can occur even without cirrhosis in some cases of liver damage caused by non-alcoholic fatty liver disease. In addition to direct liver damage, fatty liver disease is closely linked to an increased risk of cardiovascular disease. Many people with fatty liver disease do not die from the liver damage itself, but from cardiovascular complications, such as high blood pressure, heart failure, or stroke. This connection is due to the fact that fatty liver disease is closely linked to metabolic syndrome, a cluster of risk factors that increase the risk of heart disease, diabetes, and other health problems. The prevention and treatment of fatty liver disease are primarily based on adopting a healthy lifestyle. Below are some key recommendations for preventing and treating fatty liver disease. Anti-inflammatory diet. Prioritize a diet rich in whole fruits, vegetables, healthy fats, such as avocado, nuts, and olive oil, and low in simple sugars, found in ultra-processed foods, white flour, and sugary drinks. Reduce your consumption of trans fats and processed foods. Regular exercise. Get at least 150 minutes of moderate exercise per week, combining aerobic exercise with strength training at least twice a week. Exercise helps burn fat, improve insulin sensitivity, and reduce inflammation. Maintain a healthy weight. Being overweight or obese, especially abdominal fat, increases the risk of fatty liver disease. Losing 7 to 10% of your body weight can have a significant impact on reducing liver fat. Maintaining your gut microbiome. Eat fermented foods such as yogurt, kefir, and sauerkraut, and prebiotics such as onions, garlic, and asparagus to promote a healthy gut microbiome. Avoid unnecessary antibiotic use, as these can disrupt the balance of your gut microbiome. Sleep well. Poor sleep impairs insulin sensitivity and worsens liver metabolism. Aim for 7 to 9 hours of sleep per night to promote metabolic and liver health. Managing stress. Chronic stress raises cortisol levels, which can worsen liver metabolism and increase fat accumulation in the liver. Practice relaxation techniques such as meditation, yoga, or mindfulness to reduce stress and improve your overall well-being. Avoid alcohol. If you have fatty liver, it's essential to avoid alcohol consumption, as it can worsen liver damage and accelerate the progression of the disease. Controlling related conditions. If you have diabetes, hypertension, dyslipidemia, or hypothyroidism, it's important to manage these conditions as part of your fatty liver treatment. Good control of these conditions can improve liver health and reduce the risk of complications. In the early stages of the disease, treatment is usually non-pharmacological and primarily based on lifestyle changes. However, in some cases, a doctor may recommend supplements such as vitamin E, omega-3 fatty acids, or probiotics, depending on the patient's individual needs. It is essential to consult a doctor before taking any supplement, as some may have side effects or interact with other medications. Non-alcoholic fatty liver disease is a metabolic time bomb that can have serious health consequences if not addressed promptly. However, the good news is that, in its early stages, fatty liver disease is completely reversible, and liver cells can regenerate and return to normal. Don't let months or years go by with a fatty liver condition without taking action. Prevention and early treatment are critical to protecting your liver health and preventing serious complications. Remember that your lifestyle is the key to maintaining a healthy liver and a healthy body. If you found this information useful and think it could help others, please like this video and share it with your friends and family. Together, we can raise awareness about fatty liver disease and promote a healthy lifestyle for everyone. We invite you to take the following actions. See your doctor. If you have risk factors for fatty liver, such as being overweight, obese, having diabetes, dyslipidemia, or a family history of fatty liver disease, talk to your doctor about a physical exam and laboratory tests to assess your liver health. Adopt a healthy lifestyle. Follow the nutrition, exercise, sleep, and stress management recommendations mentioned above. Remember that small lifestyle changes can have a big impact on your liver health. Share this information. Share this video and article with your friends and family so they're informed about fatty liver disease and how to prevent it. Subscribe to our channel Subscribe to our channel to receive more information about health and wellness. Don't wait any longer. Take control of your liver health and start living a healthier, happier life. See you in the next video.